Hi there. My name is Kunal Agarwal, and I am here with Dr. Devas Modi, uh, and he has graciously joined us today to be a part of the ASRA Resident and Fellow Committee video interview series on recent fellowship graduates. Um, and Dr. Modi is a recent graduate of a chronic pain fellowship, graduating from Northwell. Um, and before we begin, Dr. Modi, you can just go on and introduce yourself and uh, give a little bit of background on who you are and your training.
Yeah, absolutely. Thanks for having me, Kunal. As you mentioned, my name is Devas Modi. I did my residency in New York City. My background is physical medicine and rehab. I did it at Cornell and Columbia. It's a combined program in the city. And then I really wanted to get, more exposure to chronic pain medicine, specifically a lot of the procedures that, a lot of the anesthesia folks get. So I pursued an anesthesiology ACJME pain medicine fellowship at Northwell Health, Lenox Hill, Zucker School of Medicine, also in New York City. And then now I'm currently in my first year of practice. I've joined a multidisciplinary spine group in New Jersey, and I'm excited. Yeah.
All right, awesome. So first question that I have for you, and you did touch base on this a little bit, but if you can expand on, your decision to pursue a fellowship on in chronic pain medicine versus just going into general rehabilitation.
Yeah, I during my residency, we saw a lot of patients with various musculoskeletal issues, the chronic neck pain, back pain, different joint pain, osteoarthritis, degenerative conditions, sports injuries. And, we got really good at evaluating the patients, working them up from physical exam, taking a great history, obviously, obtaining diagnostics, whether it's MRI, CT scans, or X-rays. And, I felt very comfortable reviewing these images. And I wanted that extra little bit of training and skill set to be able to offer my patients some more advanced, interventional treatment options. I'm still a large firm believer in physical therapy and rehab. It's a big part of my practice. But for those patients that unfortunately do not respond or cannot tolerate rehab, I wanted to be able to offer something that's a little bit more, interventionally based, but not necessarily surgery. And, we quickly realized that a majority of patients that have back pain or neck pain or joint pain don't need surgery. And I really wanted to adapt those skills and be able to offer that to my patients.
Okay, and moving on to your training at Northwell, what was a day in the life like as a fellow? If you can just elaborate on your overall roles and responsibilities, the call schedule, the education and didactics that they provided,
Yeah.
and any type of research opportunities that were offered.
Yeah, absolutely. Northwell, it's a pretty progressive program, very advanced, a lot of advanced procedures, cutting edge stuff that's on the techniques that are on the market. A day in the life, it depends on what rotation you were on. Majority of your year will be in the chronic pain medicine rotation, which involves clinic days. So in your clinic days, you get very, very good at evaluating patients who have chronic pain, right? Figuring out where their pain is, why, when it started, how it's affecting their quality of life. And you get really good at taking a strong history. And that's really important in pain medicine. You want to get really good at evaluating patients. So, the clinic days, you'll be evaluating patients. You'll get very efficient at taking a history, performing a thorough physical exam and a very focused physical exam, and then you're going to work them up. So are you going to order some advanced imaging? Are you going to offer a diagnostic injection? And so a lot of the procedures that involve fluoroscopy, the so-called bread and butter procedures, were performed in our clinic. We did have a fluoroscopy machine there, so you would be able to perform those procedures in the clinic. And then, for patients that needed more advanced procedures, whether it be neuromodulation or stimulator implants or peripheral nerve stimulators or some of the minimally invasive spine procedures, those would be done on a dedicated operating room day.
Okay. And, to kind of expand on the more advanced procedures, I mean, I know there a lot of most or every fellowship will get you that exposure to the bread and butter cases, but, you know, uh, how do you feel like you got sufficient training in those advanced procedures? I do know Northwell is pretty big on neuromodulation relative to other programs in the New York area.
Yes, the program director, Dr. Karen Patel, she's wonderful and she's a big advocate for embracing new technology, embracing new therapies. She's very large on evidence-based medicine, so we always go over, the latest research and publications that are coming onto the market. The our clinic was an advanced pain medicine clinic, so oftentimes we got referrals or second or third or fourth opinions. And so a lot of those patients did require advanced procedures, whether it be, basivertebral nerve ablation or minimally invasive, percutaneous lumbar decompression or neuromodulation, whether it's from, persistent spinal pain syndrome types 1 or 2 or complex regional pain syndrome. And, we saw a lot of these advanced cases that were refractory to the bread and butter cases that these patients may have had at their, private outpatient clinics or other providers. And so we got a lot of exposure to the advanced procedures. All the fellows felt very comfortable graduating and going on to offer those therapies in their own practice, including myself, which is really exciting. And it's an exciting time for pain medicine, and I think Northwell really is on the forefront of offering these new therapies.
All right, that's awesome. And for those that are watching that may not be as familiar with some of these neuromodulation procedures, but uh, there is, at least from my exposure, there are certain attendings that will just do the stimulation trials versus other attendings that will dedicate OR time and actually uh, see the implant to completion. What was your experience like? Did you get surgical training as well?
Yeah, absolutely. And that was a big learning curve for me
Hmm.
coming from a physiatry background. My last surgical experience was probably in medical school, so it was
Yeah.
a learning curve. But yeah, fortunately, we got a lot of exposure to that, and we were glad to not only do the trials, but able to do all the implants, permanent implantation, stimulators for our patients. It's really important because when it comes to neuromodulation, you want to give the patients the best shot at getting the same results as they got in their trial.
Hmm.
And with that, with the physician who did the trial, it's the same as doing the permanent implantation. You kind of remove one possible uh,
Yeah.
degree of error that can happen, where everyone has a little bit of different technique. You're more familiar with the spine, you're more familiar with the imaging. You may have noted some issues that you had during the trial, so that way you can plan, for your permanent implantation accordingly. And it's good. It's good because the care stays within the practice, and the patients feel very comfortable knowing that whoever did their trial is also doing their implant. So patients have that trust with their doctor.
Okay. And I do have some questions a little bit later about your specific practice, but just to kind of continue that conversation we were having in your own practice, are you doing uh, the implants yourself?
Yes, so I am planning to. I'm
Mhm.
pretty new out of practice, so
Uh,
it's taken some time to build up the practice, build up my patients. But the plan is to do my own implantations. I feel comfortable doing them, and I'm looking forward to offering that for my patients. The practice I'm a part of is very supportive of that, and it was important for me to find a place that embraced that.
okay. And then now kind of circling back to uh, your fellowship experience, for a lot of uh, fellows or uh, applicants in general, a lot of them do feel like in their training, they don't get a lot of exposure to the business side of healthcare and how to really
Yeah.
build a practice. Did you feel like your program provided you with those resources to ensure your success after graduation?
Yeah, I think there's always a degree of learning that's going to come once you are in private practice, or sorry, once you are in practice on your own as an attending. But during our fellowship, we got a few lectures, certainly on billing and coding, knowing how to appropriately document so that way you can get the therapies approved for patients. It's really important. After a certain encounter, a certain procedure, you know, towards the end of the year, the fellows were comfortable putting in some, of the billing and coding for, so that way you can understand how to appropriately bill for the services that you're going to
Yeah.
be providing for your patients. That's important, and to appropriately, be compensated for whatever it is that you're performing. So we did get lectures on that, and it was a part of the daily discussion as we move through the year.
Okay. And how was the job search like as you were in training? Could you maybe elaborate on the timeline of events and how your fellowship helped you in getting your current job?
Yeah, absolutely. It's funny because pain medicine fellowships are only 1 year long, and
Mhm.
so just when you're getting started with pain medicine fellowship, you start to realize that you need to start looking for a
Yeah.
job pretty early on. Um, Most of our fellows, we all started the job hunt pretty much after our primary board certification. So oftentimes that'll take place in late summer, early fall, so July to September, depending on your background. And then once that was over, I think all the fellows, including myself, started to look for our first job. A lot of it was through word of mouth and networking. And that's really, really important because oftentimes the great roles are found that way and they're never even posted on a job board. So taking advantage of your network, our program director, Karen Patel, was very, very hands-on. She, let us know. She wanted to know what kind of practices we were looking for, what geographic location, and she was happy to connect us with any of her colleagues that she knew. And that was actually very successful for a lot of us. Other opportunities can be through communities like ASRA or other organizations, as well as your residency. You have to remember that whatever network you build prior to fellowship is also very important. So, I was fortunate enough to find my position that way, and I was happy to pretty much have everything finalized by the end of the year in December. And that made the rest of the fellowship year very, very, a little bit more relaxed. I didn't have to
Yeah.
focus on two things at once. I knew where my opportunity was going to be. I knew what sort of procedures I was going to be offering, and really just focus on the second half of the year, just refining my skills and getting ready for my first opportunity.
Hmm. And you just to further elaborate, you're in a private practice, correct?
Yeah, I was keen on. I was actually open. I interviewed for
Uh-huh.
hospital jobs. I interviewed for academic positions as well as private practice.
Mhm.
I was happy to find a multidisciplinary group. So we have orthopedic spine surgery, neurosurgery, spine surgeons, as well as a few physiatrists and a few interventional pain medicine doctors. I'm a firm believer that musculoskeletal care and spine care is best served in a multidisciplinary environment. Everyone who has back pain doesn't need surgery, and some do need surgery. And it's nice that when you have multiple specialties working together, collaborating, bouncing ideas off each other, and it's overall a great experience, not only for the physicians because we get to, have discussions about interesting cases and bounce ideas, and but also for the patient. In today's world, it's always you go see a doctor, you get a referral, then you call the other office. They may or may not take your insurance. It's just a lot of running
Yeah.
around for the patient. So I was happy to find a group where everything is kind of in-house. We can talk to each other and share patients and collaborate.
No, yeah, I completely agree. I've seen that firsthand. I'm in my program's uh clinic at Montefiore, we have a multidisciplinary
Yeah,
spine center, and just seeing how an interventional pain physician can interact with the spine surgeon is it it's wonderful for the patient. We can
yeah.
see them if we think ourselves that they might be a better surgical candidate. We can get those MRIs and get the authorization approved by the time that the spine surgeon has the discussion with the patient. So it makes things run a lot smoother.
Yeah, absolutely, absolutely. I had the same experience in my academic, journey in residency and fellowship, and I think it works really well. So I was happy to find that.
Okay, so you've touched on a lot of great strengths at Northwell, but if you feel comfortable, are there any specific things that you felt your program could have improved upon?
Um, the program had some changes over the years,
Mhm,
and we didn't, like every program, faculty will change and that sort of thing. So I think we um, we probably could have used a little bit more faculty,
mhm,
especially early on. But once we got the year going, we were introduced to some other faculty, and then the year ended up being great. But to start off, I guess we were just a little confused on the faculty situation.
mhm.
But it ended up being great, and I think the program will continue to grow. And I think the exposure that you get from the different procedures and the complex patients just produces a really strong pain medicine
Mhm.
physician. Yeah.
Okay, and given that you are in your first year of as an attending, looking back at your long and robust medical journey, is there anything you would have done differently?
Uh, Not really.
Uh,
I think everything eventually falls into place. I'm very happy with the training that I received. I'm thankful for all the mentors I've had along the way. And so far I'm very comfortable, and I think I'm happy with the journey I've had. Yeah.
okay, and my last question is kind of a three-part. Uh, if What type of advice or recommendations would you give to uh, a current fellow, a resident who's interested in interventional pain management, or even a medical student who's thinking about getting into interventional pain management?
Yeah, I think it's a very exciting time right now. There's a lot of new therapies that are coming on the market. There's a lot of new research that's being done in the field of pain medicine, especially after what has happened over the past few decades with the opioid crisis. There's a lot of focus on chronic pain medicine. So I think it's definitely an exciting time. The piece of advice I would give is, pain medicine fellowship, it's a short period of time. It's only 1 year. And when evaluating programs and evaluating where you want to go, people often just focus on the numbers. Oh, how many injections am I going to do? How many stimulators am I going to do? Which is very important. But I think at the thing you need to focus is on is building a strong foundation in pain medicine. Any
Mhm,
field of medicine, you're going to continue to learn and evolve over the years. But I think building a strong foundation is very important. And I think that's probably on three principles. One being anatomy. You want to learn your anatomy um, as much as you can. Study the textbooks, go back to your old medical textbooks, learn the spinal anatomy, learn where the nerves exit, learn about the different ligaments. And on top of that, learn really good fluoroscopic anatomy. Procedures change, techniques change, but all of it is kind of based on the same fundamental of fluoroscopy. And now, even more than that, is ultrasound. Really
mhm.
get comfortable using those two imaging modalities to help guide your treatments because techniques will change, new procedures will come. But if your foundation in those are very strong, you'll do very well. The second would be get very good at evaluating a patient. You have to take a good history, you have to do a good physical exam and read all your own imaging. If you're going to order the MRIs, don't just rely on the report. There's so many times where even in my short time in practice, I've caught things that the radiologist didn't catch, and it's not their fault. They're just reading tons of MRIs a day, and they're looking for the main structures that they are. But you have the benefit of having the patient. So if you can read your own MRIs, read your own imaging, and correlate it to the patient, that's very powerful. And the third is just, the more procedures you do, the more injections you do, new therapies that you offer, you're going to have complications. So learning how to manage complications if and when they happen is probably the third most important thing you can do along your training. So that's probably what I would offer for medical students, residents, or fellows is really focus on those three things, and that'll set you up for great success.
All right, thank you. So this concludes our video interview with Dr. Modi, recent chronic pain medicine fellowship graduate. Thank you everyone for watching.